If you take vitamin B12 every morning, what you're doing to protect your health could actually be putting your heart and brain at risk. Especially if you're over 60 and on certain common medications, this is something you absolutely need to know before your next dose. Right now, something is happening inside millions of seniors across America that has no pain attached to it. No dizziness, no chest tightness, nothing that would make you put down your coffee and call your doctor. And yet, it is quietly raising the risk of stroke and arterial damage in people who are doing everything they think is right. One of the most trusted supplements on the shelf, vitamin B12, becomes dangerous when it meets the wrong medication. When you combine high-dose B12 with one of two common medications, it creates a molecule called homocysteine that acts like sandpaper on the inside walls of your arteries, raising stroke risk significantly over time. Today I'm revealing which two medications create this interaction, exactly why it happens inside the body, and precisely what to do to protect yourself. I'm Dr. Markus Dexter. Type your age in the comments right now, just your age, because what I'm about to share hits differently depending on how long you've been on these medications. And drop a comment telling me where you're watching from. I read every one. Here's something that set the stage for everything we're covering today. A study published in the Journal of the American Medical Association found that seniors who took high-dose B vitamins, including B12, over an extended period actually showed increased cardiovascular risk under certain conditions compared to those on lower doses, not decreased, increased. That finding stunned many in the medical field. When you understand the mechanism, it makes complete sense. The first medication is Metformin. If you have type 2 diabetes, there's a very good chance you're on it. It's one of the most prescribed medications in America for controlling blood sugar, and it's genuinely effective. But Metformin has a side effect that most patients are never clearly told about. Over time, especially over years, Metformin interferes with something called intrinsic factor in your gut. Intrinsic factor is a protein your stomach produces that acts as a delivery vehicle for B12. Think of it like a taxi. B12 gets in the taxi, and the taxi drives it to where it needs to go in your bloodstream. Metformin quietly damages that taxi system. It makes it less reliable, less consistent. So your doctor sees low B12 levels and says, take a supplement. You go out and buy a high-dose B12 tablet because more feels like better. For a while, your blood levels of B12 rise and your doctor says everything looks fine. But here's what that blood level is not showing you. It's not showing you what's happening downstream, because when B12 cannot be properly processed and transported due to the damaged intrinsic factor system, it begins to interact with another molecule in your blood called homocysteine. Homocysteine is an amino acid your body produces naturally. In small amounts, it's harmless. Your body uses B vitamins, including B12, B6, and folate, to convert it into something useful and clear it from the bloodstream. But when that conversion process is disrupted because B12 is not being properly absorbed or processed, homocysteine builds up. And elevated homocysteine does something very specific and very damaging. A research team at Harvard Medical School described it this way. Elevated homocysteine doesn't cause a sudden blockage the way a clot does. It causes chronic abrasion. It inflames the arterial wall. It makes it stiff. It makes it easier for plaques to form and harder for the vessel to expand and contract the way a healthy artery should. Think of your arteries like a flexible rubber hose. When they're healthy, they stretch and rebound with each heartbeat. When homocysteine has been scraping those walls for months or years, the hose becomes more like a rigid plastic pipe. And rigid pipes crack. They don't flex under pressure, they break. In the cardiovascular system, a break like that is a stroke or a cardiac event. Hit the like button if this explanation is helping you understand what's happening in your own body. How many of you have been on Metformin for more than 3 years and also taking B12 supplements? Be honest with yourself right now, because this combination is happening in people's bodies every single day, and almost nobody is connecting the dots. The second medication affects even more people, and its interaction with B12 is different from Metformin, but in some ways even more unpredictable. These are proton pump inhibitors, commonly known as PPIs, medications like omeprazole and pantoprazole that reduce stomach acid. They're prescribed for acid reflux, esophageal damage, and ulcer protection. And they are extraordinarily common among seniors because acid reflux becomes more frequent after 60 as the digestive system changes. But PPIs do something most people never hear about at the pharmacy counter. They reduce the stomach acid that is necessary to release B12 from food in the first place. Your body needs an acidic environment to break down the protein bonds that hold B12 in food. When you reduce that acid with a PPI over months and years, your dietary B12 absorption drops significantly. A study published in the Annals of Internal Medicine followed over 25,000 patients on long-term PPI therapy and found that after 2 years of continuous use, PPI patients showed measurably lower serum B12 levels. After that finding, what do most doctors do? They recommend a B12 supplement, which makes sense on the surface. The problem is that in certain individuals, especially older adults with reduced kidney function, the B12 supplement is not processed and cleared efficiently. It accumulates in the blood in a form that interacts poorly with the homocysteine cycle. But here's what's particularly concerning. Some patients on long-term PPI therapy develop something called rebound acid hypersecretion. When the medication is metabolized overnight, the stomach overproduces acid in a compensation response. During that rebound window, the B12 supplement is being processed in an unpredictable environment. The absorption becomes erratic. And erratic absorption means erratic homocysteine management. Some days the system clears it, some days it doesn't. When was the last time your doctor asked you specifically whether you were on a PPI and also taking B12 at the same time? Type never in the comments if the answer is never. I want to see that number because I think it's going to be sobering. Now here's where everything we've covered comes together. Homocysteine is almost never included on a standard blood panel. Your doctor checks cholesterol, blood sugar, thyroid, maybe B12 itself. But homocysteine requires a separate test, and it has to be specifically ordered. The Cleveland Clinic has called elevated homocysteine a significant and under-recognized risk factor for cardiovascular disease in adults over 60, and yet most seniors have never had it tested in their lives. Here's why that matters so much. When homocysteine levels stay elevated over months and years, 3 things happen inside your cardiovascular system. First, the inner lining of your arteries becomes inflamed and begins to lose its natural smoothness. Second, small oxidized particles of LDL cholesterol find it easier to embed in those inflamed walls and form plaques. Third, the plaques that form in a high homocysteine environment are more likely to rupture unstably. They break off and travel through the bloodstream rather than sitting in place. That last point explains strokes in people who have no major blockages on imaging. The plaque was there, it was unstable, it broke loose. Researchers at the Mayo Clinic found that elevated homocysteine is present in a disproportionate number of these so-called unexplained strokes. The cause was not mysterious. The right test was simply never ordered. This is not meant to frighten you without purpose. This is meant to give you knowledge that puts the power back in your hands. Let me tell you about Beverly, because her story is the one I want you to carry with you. Beverly was 74 years old. She had been on a PPI for 14 years and had been supplementing with B12 for the last 5 of those years. Her daughter had come across research connecting homocysteine to heart health and brought her mother in with a printed article. Beverly was skeptical. She felt fine. Her blood pressure was managed. She walked her dogs every single day. Her homocysteine came back at 31 micromoles per liter. The safe range is below 15. At 31, she had more than double the level associated with significantly elevated stroke risk. And yet, no symptoms, no warning, no clue, just a number on a page that explained exactly why her arteries had been working harder than they should have been for years. Here is what we changed. The supplement form was switched from cyanocobalamin to methylcobalamin, the active bioavailable form that bypasses the conversion steps her body was struggling with. A low-dose B6 and folate supplement was added to support the homocysteine conversion pathway, and the B12 was timed away from her PPI dose to maximize absorption. A follow-up homocysteine test was scheduled for 90 days later. When Beverly came back 3 months later, her homocysteine had dropped from 31 to 17. Not perfect yet, but moving in exactly the right direction. She told me she hadn't realized how tired she'd been feeling until she started feeling less tired. If you've been doing this for years, it is not too late. The vascular inflammation that homocysteine causes is not permanent when caught before a major event. Beverly proved that in 90 days. The body has a remarkable ability to recover and rebalance when you give it what it actually needs. The answer is not to stop taking B12. B12 is genuinely essential after 60. Deficiency causes nerve damage, fatigue, cognitive decline, and yes, cardiovascular risk of its own. The goal is not less B12. The goal is smarter B12. Here's exactly what smarter looks like. First, if you're on Metformin or a PPI, the most important thing you can do right now is ask your doctor to test your homocysteine level and your active B12 level. Not just total B12 in the blood, active B12, the form your body actually uses. Total B12 can look normal while active B12 is critically low. That distinction is one many standard tests miss entirely. Second, The form of B12 matters enormously. Most supplements on store shelves contain cyanocobalamin, the cheapest form to manufacture, requiring your body to perform several conversion steps before it can be used. For older adults on metformin or PPIs, those conversion steps are often compromised. Methylcobalamin bypasses most of those steps. It is already in an active, usable state. Research published in the European Journal of Clinical Nutrition found that methylcobalamin raised functional B12 levels more reliably in older adults than cyanocobalamin at equivalent doses. The answer is not to stop taking B12. B12 is genuinely essential after 60. Deficiency causes nerve damage, fatigue, cognitive decline, and yes, cardiovascular risk of its own. The goal is not less B12. The goal is smarter B12. Here is exactly what smarter looks like. First, if you're on metformin or a PPI, the most important thing you can do right now is ask your doctor to test your homocysteine level and your active B12 level. Not just total B12 in the blood, active B12, the form your body actually uses. Total B12 can look normal, while active B12 is critically low. That distinction is one many standard tests miss entirely. Second, the form of B12 matters enormously. Most supplements on store shelves contain cyanocobalamin, the cheapest form to manufacture, requiring your body to perform several conversion steps before it can be used. For older adults on metformin or PPIs, those conversion steps are often compromised. Methylcobalamin bypasses most of those steps. It is already in an active, usable state. Research published in the European Journal of Clinical Nutrition found that methylcobalamin raised functional B12 levels more reliably in older adults than cyanocobalamin at equivalent doses. Step 1. Check your medications. Are you on metformin for diabetes or a PPI like omeprazole for acid reflux? Step 2. Check your B12 supplement. What form is it? If it says cyanocobalamin, switch to methylcobalamin. Step 3. Check your dose. If you're taking more than 1,000 micrograms daily, you are very likely overdoing it. Step 4. Schedule a homocysteine test. Call your doctor and specifically request a homocysteine level alongside active B12, not just total B12. Step 5. Add B6 and folate support. These work synergistically with B12 to process homocysteine correctly and keep it clearing from the bloodstream. What you've learned today is this: metformin and B12 create a dangerous interaction through the intrinsic factor pathway, leading to elevated homocysteine and arterial damage over time. Proton pump inhibitors reduce the acid environment needed for B12 absorption, creating an erratic processing pattern that disrupts the homocysteine cycle. Homocysteine is almost never tested on a standard panel, and elevated levels in seniors are a significant under-recognized cause of stroke and cardiovascular events. The fix is not stopping B12, but switching to methylcobalamin at a smarter dose with B6 and folate support. Comment below and tell me, are you on metformin or a PPI and also taking B12? I want to see how many of you this applies to. And if this video helped you understand a danger you didn't know existed, please share it with someone over 60 who's on these medications. Your share could literally prevent a stroke. Subscribe for more evidence-based health information every week. I'm Dr. Markus Dexter. You now know something most people have never been told, and that knowledge belongs to the people you love too. Take care of your heart. I'll see you in the next one. This video contains general medical information based on published research and clinical experience. It is not a substitute for personal medical care. Never change or stop your medications without consulting your physician. Always speak with your healthcare provider before modifying your supplement routine, especially if you are on prescription medications.